Hello, you're listening to the MiCare Champion Cast. I'm your host, Lucy Chimatero of the Michigan Health and Hospital Association. Each month, we invite industry experts and thought leaders to discuss relevant healthcare issues. Join us as we explore key topics that affect Michigan hospitals, health systems, and the health of our communities. Hello, and welcome to episode 24 of the MiCare Champion Cast. In today's episode, we're going to explore the critical role that hospitals play in Michigan's rural communities and the impact healthcare workers have on their patients, who often double as neighbors and friends. Our rural hospitals are some of the most innovative providers who are tasked with caring for our most vulnerable residents with less resources than their urban counterparts. With this in mind, it's an honor to welcome our first guest of 2023, Dr. Ross Ramsey of Scheurer Health. Dr. Ramsey has a unique experience of being a physician before becoming a healthcare leader in rural Michigan. He's going to share with you why working in rural Michigan is so meaningful and why healthcare workers might consider a career in the less populated areas of our state. With that, Dr. Ramsey, welcome to the show.
Hi, Lucy. Thanks for having me today.
Yeah, it's a pleasure. We're very excited to have you. And you are the first person to experience the new studio, even virtually. You get to see kind of how fancy it looks in the background.
It's very fancy.
All right. So you are currently the president and CEO of Scheurer Health, but you also have a clinical background. So I'd love if you could start by sharing with our listeners a bit more about your role and what led you to Scheurer.
Sure. So it goes way back to my childhood, actually, and the fact that I was born in a rural area up here in the thumb of Michigan. I was actually born in Harbor Beach, which is across the county from Pigeon, where Scheurer Health is located, and grew up there. And as a child, it was interesting. I always remember going to see the doctor, and like many rural locations, you'd have doctors that would flow through. They tended to be there because they needed a visa. Some weren't even great at speaking English in a community that only solely spoke English. So you saw a lot of those deficiencies in healthcare even years ago when I was a child. And growing up, you didn't think much of it. And then I went off to undergrad and medical school and did both of those down at Michigan State in East Lansing there. And while I was there, obviously you broaden your horizons quite a bit, although going from a town of 2,000 and moving into a dorm of 1,200, it is quite the jump.
Right.
But you make the jump, and I enjoyed it. I loved it. Mm-hmm. And I trained that way, and the longer I was away from the rural community, the more I realized that I missed that. Not only that, I missed the lake that is up here in the thumb, Lake Huron, and eventually wanted to move back this way. So I kind of circled the state, spent time in East Lansing, Grand Rapids, did residency in Midland there, and then kind of slowly ventured back up towards the thumb here. And it was great to get back to a rural community. While it's close to where I grew up, it was still a totally new community for me to settle into, where, as you mentioned, your neighbors doubles in patients and fellow employees and all of the above. So it was kind of a full circle way that I ended back up here, but it goes back to the start of the story where I realized there is really a lack of local people who wanted to go back to those local communities and provide health care. Everyone else in a rural community tends to either have a connection to the area or have grown up in the area. Yet healthcare, while they are some of the biggest economic drivers in those communities, don't have that connection most of the time. So it's kind of a juxtaposition there.
Yeah, I grew up going to Caseville every summer with my family to a cottage, and I loved it. It's so underrated over on that side of the state. So I can appreciate what you're talking about. And before we get into the serious stuff, I have been tasked with asking if the rumors are true that while you were in med school at Michigan State, I was about to say U of M, that would have been a big mistake. At Michigan State, you also were Sparty. Is that correct?
I was,
yes. Oh my
so
gosh.
I spent 2.5 years as the mascot Sparty. And actually, my claim to fame there is I did win 2 national mascot championships.
There are championships for mascots?
There are.
Wow.
So, like if you turn on ESPN and you see the cheerleaders doing their thing, the big competitions down, usually at Disney World, they have the mascots at the same time. but they don't give them the same airtime for some reason.
Wow, how
And
unfair.
I won in 2005 and 2007.
That's
so I have a
amazing.
couple of big rings to show for it, but I don't wear them very often.
That's awesome. I hope you got free tickets to every game for being in that role, because I can't imagine it was always so glamorous.
No, it wasn't. And no free tickets, but, it was a lot of fun. But I certainly enjoyed it. People then asked how I was a mascot while in medical school, and I shrugged my shoulders and said, I don't know, you just get through it. It was kind of my release. And now I look back and go, how did I do that? So it was a fun experience.
That is very fun. Well, to dive into today's discussion, I just had to ask that question. I knew my coworkers would want me to. So we know that many healthcare workers have retired or changed career paths as a result of the COVID-19 pandemic. But on the other hand, we know a lot of people have felt sort of recommitted to their career in healthcare, and they remain committed to healthcare through, the toughest years that they've experienced in decades. So I'm just curious, on a personal note, what has kept you in healthcare, even as a leader?
Yeah, well, number one, on a little more lighthearted side, I'm too young to retire, so that was not an option for me. But the reality is, you go back years ago, and I always remember, you watch these movies where these pandemics strike the world, and you're like, oh gosh, yeah, we're all going to just run and hide. Mm-hmm. Well, when you're in a rural community, you're literally all they have. So you look at the scenario and you go, well, if I don't show up to work the ER, mm-hmm. there's going to be no ER. So you end up just by default being there. And I think truly what it comes down to is there's a big period of time there where there was the whole healthcare hero movement and that type of thing. And ironically, the pandemic hadn't really hit the rural communities hard at that point. It was really down the line that it struck us harder. And it was just the appreciation of the community that really recommitted you to serving that community, because those are the same people that you would see out and about around town. Mm-hmm. Those are the ones that would really thank you, and they truly and genuinely meant it. If you knew them versus if you were in a larger community where you may not know individuals, they're not going to just walk up to you and thank you in the middle of Meijer for what you're doing. Mm-hmm. So I really think it was the impact you made on the community, and it was truly palpable, that drove you to continue to do that. Mm-hmm. And, you found that they did their part to get the community through the pandemic, and you needed to do that as well. Yeah. So it really, really kept me here. As a leader, we were very worried about losing a lot of employees through all of this.
Right.
A lot of people went and did a lot of travel nursing, for instance, around the country. We have always really pushed our culture here, and our employees knew that, and they knew we were a great place to work, and knew if they left and did some travel nursing or things like that, the scenario probably wouldn't be as great as it was here. We always thought of ourselves as a little oasis in the middle of the pandemic, right? Because we kept that culture going. So it really not only drove me to stay here, but our employees to as well. So it did work out really well. And I think in the end, once you get through any stressful event, everyone gives each other a high five, and you're recommitted to each other, and you really just push forward.
Right. Yeah. That's amazing. And we need people with the passion and dedication that you're describing to be in healthcare. That makes a huge difference to the patient experience. So speaking of leadership, we know Scheurer is based on some core values that center around people, services, and quality. So with that in mind, I'd wonder what efforts you've seen underway either in your organization or in other rural healthcare organizations. What makes healthcare staff feel valued and supported?
So we have what we call the Scheurer Way, and that's kind of our cultural program that we have. That's our formalized program within the organization that helps impart that value to employees to really push on that people, service, and quality that makes us who we are. Mm-hmm. That's really at the basis of everything we do here. But our Sure Way has several teams of frontline employees, and those teams are led by frontline employees. And it's kind of a bottom-up approach compared to a lot of other organizations that might use more of that top-down approach in terms of building that culture. As a result, those teams lead a lot of initiatives throughout the organization that we find really instills that culture. And by instilling that culture, really brings value to employees. We always remember to celebrate wins, no matter how big or small they might be. While we couldn't necessarily do things in person over the last few years, for instance, we would always have a big Christmas lunch appreciation for everyone. We obviously didn't want to gather together all 500 of our employees at once and then hope that no one goes down all at once through the pandemic. So we figured out a way to still have that lunch, but package up 500 prime rib dinners and send them out to all the departments. So we continued to work to continue to appreciate our employees in the way that we normally would, even though we had to modify it some.
Yeah.
Instead of a Christmas party, we went and had an outdoor winter fest where we had an outdoor event and fireworks over the lake in the middle of the winter.
Wow.
Just some different things to try and really continue to keep community within the culture of our organization, despite what normally would be roadblocks for us to do that.
Right. If you had to describe rural healthcare in one or two adjectives or the culture of rural healthcare, what words would come to mind for you?
That's tough to boil it into one or two words.
Maybe one or five. We'll make that the cap.
I definitely think that community and teamwork are probably two of the biggest because if we're not here to take care of the community, there will be no community because we all need to be healthy. And really, it's a team approach because we don't have enough of every employee type to do everything. So we all wear multiple hats. Even as CEO here, I still wear the hat of a physician and still work in my clinic and still see inpatients and occasionally still get roped into working an ER shift here or there. So we all need to be a team to really pull through this together.
Yeah, that's amazing. And you touched on it a little bit, but can you just go into a little more depth to our listeners on the role that healthcare plays in rural communities beyond the care they provide?
Yeah, so hospitals in rural communities or healthcare in rural communities as a whole are huge economic engines for your community. In our county, even though we only hold about, I don't know, maybe 5% of the population of the whole county in our town, we employ the largest number of employees in the service industry in our county. We employ 500 individuals here in our workforce, and in the county as a whole, there are only about 20,000, and that's a high number within the county. So we're a huge employer within the county, and that economic impact really rolls out across the whole county. So that is one of the big obvious drivers and impacts that we have on the community. But then it also has a big impact in terms of the type of employees that you employ. We're not just employing your basic employee that you might have, for instance, at McDonald's or things of that nature. They generally are educated individuals. So you don't have people with doctorates coming back to work really in other industries in rural communities. With remote work, you've seen a little more of that. But at the same time, that also plays into the fact that if you don't have good health care in your community, people will not retire in your communities. They'll move to an area that has better health care. And a lot of people choose to retire in our community because we're known for our good health care. You also won't get people who remotely work from your community because they want to live somewhere that has health care as well. So we have seen some uptick in our community of remote workers who ultimately moved to their cottage on the lake. That is a bonus for us to have some increase in education, but they've also told me in the past that if there wasn't good healthcare here and there wasn't a good grocery store here, they wouldn't be living here.
Right.
So it really has a big trickle-down effect.
Right. Have you ever received really meaningful feedback from the patients that you serve? Do you have any stories?
Yeah, so it is always amazing the impact that you make, and it's always impactful when you get those patient letters in the mail. And we do get them on a regular basis. This past week, we had a patient who was in her late 90s who had lived in our senior communities here for years and years. And it was certainly heartfelt among all the staff and particularly the family when the patient had realized that she could no longer be in an independent living scenario that we offered. So it was very meaningful for us to be able to allow that patient or that individual to move to our assisted living community, and she passed shortly thereafter. And it was very meaningful when the family reached out and just was very appreciative of the fact that there was support for them to make sure that their mother, their grandmother, their aunt was able to be supported in a way that otherwise they might be left standing alone if we didn't have those resources in our rural community.
Right. Absolutely.
So it's things like that that you don't even think about often on a regular basis, but then you get that little note in the mail that tells you how much that impacted a family. That makes a big difference there.
Yeah, I'm sure it makes a difference to the staff who is working with that patient as well. It could probably make a huge difference to their. We know that healthcare workers are under a lot of stress and strain, so a thank you goes a long way. And when it's a handwritten thank you, and it makes it all the more meaningful. So, along those lines, we talked about feedback from patients. What feedback have you received from your staff? And I know you said culture is a huge part of why the Scheurer staff stays. What else do you think contributes to them staying in healthcare through such stressful years?
It certainly has been stressful, and it is interesting because we have not seen a big uptick in retirements or things of that nature that we've seen across the board in America. Certainly, it does come back to that culture, but we've definitely made effort to support our employees and just do fun things as well that makes them want to stay here. I know we, this past year, had implemented when the weather was a little warmer, where we had food trucks come in every day, which otherwise aren't in the community. So they came in for lunch and dinner. We had a different food truck every day of the week for a month or two straight over the summer, which was great. And also provided some much needed relief for our nutritional services department as well.
Yeah.
So
who also deserve a break.
They do. So it's funny. People are like, well, you're taking away from the cafeteria. No, trust me, they need the break. And they were very happy over that themselves.
Right, yeah.
So it does make a big difference just to continue to find ways to be innovative about adding different change of pace and activities to your daily workforce.
Yeah, that's great. And a question that I have for you, a little bit different than what we've been talking about, is just any thoughts you have about how we can better support rural hospitals at the state and federal level? Is there anything that comes to mind for you that you would want to mention?
Like everywhere in America right now, from a health system perspective, obviously, funding is a big thing. A lot of the new models for payment with value-based models are great. However, they do undercut some of the long-standing systems that are out there to support kind of that cost-based model that has helped support rural communities. And I believe that has really increased the uptick in hospital closures across rural America. So that advocacy that you do both at MHA and the AHA is very vital for us in rural America. We don't have a great way to scream from the top of the mountains quite the way that big health systems do otherwise. And it's important to continue to ensure that there is financial security there. And it goes back to what I mentioned earlier. If there aren't hospitals in rural America, the whole economies of small towns across America just crumble, which creates a whole nother issue, especially when you start to look at social determinants of health as well.
Yeah, and that's not an exaggeration at all.
No. So that is obviously the big thing, but big hospital systems would say the same goes for them. So while the challenges are similar in some regards, they are a little different in the fact that recruitment is difficult for big systems, but it can be nearly insane when you're trying to recruit certain workers to small America as well. So it's gotten even more difficult for us to fill already difficult positions. And there's no amount of money that can really fix that issue. So it's a matter of helping small hospitals find ways to develop pipeline programs with particularly training programs that aren't necessarily in their community. A lot of education has gone virtual, and there's a lot of opportunities in rural America that can be accessed via, virtual opportunities as well, versus tapping into just the big systems with virtual options. So that is definitely an area that we're trying to capitalize on also.
Yeah. What other recruitment efforts have been really successful for you guys?
We have really found the training or building your own is really the most successful we've had in terms of our workforce as a whole. We've integrated some programs where we're doing some kind of what people would consider the old co-op type positions with high schools in the area. We've really supported our workforce in terms of job skill development, going and advancing their training. We've also tried to team up a lot with different universities and colleges in terms of providing training sites for their students, which really is one of the biggest things. We've had great success in terms of that with a physician pipeline, which is crazy because physicians are often the most difficult thing to recruit to rural America. Yet in terms of primary care, we've been very successful with that because of our relationships, particularly with Michigan State and their medical schools there, as well as their residency programs as well.
Yeah. Who doesn't want to work at Scheurer when Sparty's recruiting you, right?
Makes the sales pitch a little easier.
Right. I love it. Well, that leads perfectly into my last question, which is a two-parter about what we've been discussing. But what would you say to someone who's considering a career in healthcare, and what would be your elevator pitch, so to speak, to work in a rural hospital?
Yeah, so rural healthcare truly is rewarding. Both from a emotional sense as well as from the sense that a lot of those positions are pretty well paid fairly similarly, especially take a physician, for example. I know from experience, I would make pretty close to the same thing, whether I'm in rural America or whether I'm in the middle of Chicago. So your dollar gets to go a bit further, if you will, when you're living in rural America. Doesn't mean you don't get to do cool things. You still get to go to those Tigers games, those Red Wings games, things of that nature. But you get to stretch your dollar a little further. At the same time, you get to live often where we're at in a resort community ultimately, where people come to spend their summers here, and looking out your back window and looking at the lake is what you do every day of the year. So there are a lot of great lifestyle things that come along with working in rural communities, yet you really get the emotional impact of really helping those around you that we've discussed earlier, that really would make working in rural America a great thing. Careers in healthcare also very rewarding and secure, if you will, from the sense that it's not quite like the current tech giants that are just axing jobs by the tens of thousands. I've yet to see that happen in healthcare when you're actually providing services to patients that are truly needed.
Right. Yeah, we always need healthcare workers.
We certainly do. And we're always certainly hiring.
Right. Well, if listeners are interested in learning more about opportunities at Scheurer, where should they head to?
They should head to www.scheurer.org. That's SCHEURER.org.
Perfect. Love it. Well, we can't thank you enough for being here today, Dr. Ramsey, and look forward to what's ahead for Scheurer Health. And it makes me want to go visit Caseville again. I haven't been there in years, but the cottage we had was right on the water, and it was like my favorite place to go.
Come on up. We're here.
Well, with that, I'd like to thank our listeners for tuning in, and be sure to check out the episode's description to learn more. And we will provide the Scheurer website there that Dr. Ramsey mentioned. So if you're interested in careers, be sure to head to their website. With that, thanks, and have a wonderful rest of your day.
Thanks, Lucy.
Thanks for listening to the MiCare Champion Cast. To learn more or get involved, visit MHA.org.